Ecological and physiological effects of kangaroo care and traditional care. How the infant's body changes after birth. The lungs must breathe air, the cardiac pulmonary circulation changes, the digestive system must begin to process food and excrete waste, the kidneys must begin working to balance fluids and chemicals in the body and excrete waste. The liver and immunologic systems must begin functioning independently. What qualifies an infant to enter the NICU? Most babies admitted to the NICU are premature, born before 37 weeks of pregnancy, have low birth weights less than 5.5 pounds, or have a medical condition that requires special care. Some high-risk factors that could get an infant admitted to the NICU are medications or resuscitation in the delivery room, birth defects, respiratory distress including rapid breathing, grunting or apnea, stopping of breath, seizures, hypoglycemia, low blood sugar, need for extra oxygen or monitoring, intravenous IV therapy or medications, need for special treatment or procedures such as a blood transfusion. What is kangaroo care? Define a method. Kangaroo care is a method of caring for premature babies in which the infants are held skin to skin with a parent, usually the mother, for as many hours as possible every day. There are many ecological benefits of kangaroo care for both the mother and the baby. Here are a few examples that were found in articles on other care. Establishes bond and attachment, positive mother-infant interaction, facilitates infants' social and cognitive growth, infants show less negative emotions, infants are better expressing their needs, low stress and depression, mothers feel more competent in looking after their babies.
There are also a couple of psychological effects of traditional care within the NICU. Some of the benefits we found was that there's a reduced noise in the NICU when using traditional care. The continuous overload of sounds, including alarms, doctors, nurses, and parents, is extremely difficult for a newborn to process. By keeping parents out of the NICU, it reduces the volume in the room. Quiet rooms allow the baby to process the stimuli at a pace which won't be overwhelming and allow them to continue to grow in order to achieve leaving the NICU. One of the negatives we found of traditional care is that it causes lower releases in oxytocin. Oxytocin is a neurotransmitting hormone that creates an increase in bonding and love connection. Babies missing the initial interaction of mother have lower releases of oxytocin, which leads to a disorganization of the stress handling section of the infant's brain. Physiological benefits of kangaroo care is studies have shown that infants receiving kangaroo care show an improvement in oxygen saturation as well as reduce in oxygen requirements, improve the infant's temperature as well as the infant's heart and respiratory rate. Infants receiving kangaroo care breastfed longer, which leads to a faster growth and rate of development. Kangaroo care has shown to improve infant sleep-wake cycle and has showed that infants spent a greater time in quiet, deep sleep and alert wakefulness and less time trying to fall asleep. Other benefits include higher level of blood glucose, infants having higher vital signs, and finally reduced hospital stays and illnesses. This table shows the result of a study that was conducted on 300 mothers and their low birth weight babies. On the first day, kangaroo care was started for an hour, then increased by an hour each day for the next 2 days. The infant's temperature, respiratory rate, heart rate, and oxygen saturation was evaluated for 3 consecutive days before and immediately after kangaroo care. The results showed modest but statistically significant improvements, proving that kangaroo care does benefit the infant's physiology. Some physiological benefits of traditional care include that the mother has time to rest. After a lot of time spent in labor and delivery, mothers are able to rest until she is ready to interact with her baby. The medical attention. Infants who are born with complications or require some type of medical attention are able to receive the help that they need. They also have constant care. Babies are under continuous care and are able to receive immediate attention if needed. What is necessary for a NICU baby to be discharged? The baby has to be off all respiratory support, baby is off IV fluids and receives all calories by breast milk or formula and has consistent weight gain. The baby is able to maintain temperature in an open crib. The baby is able to complete all bottle feedings and no longer requires antibiotics and no longer has apnea episodes. The parents must have finished a CPR class, medication teaching completed, and prescriptions given. All vaccinations have been completed. State metabolic and hearing screenings have been completed. Circumcision performed if the family wishes. Car seat test completed. Special discharge teaching completed, including home health instructions.